that's a big jump, but it's enough that we were able to budget for it. And UHC knows about it. So it's the best, worst news ever, right? But there's nothing new that's scaring underwriters. The medical is the main thing that has some new cost drivers for it. We go to the next slide, please. All right, this is a rolling 12 claims draft. So what color is that? Red, yeah, we'll go red and orange. So the red is 2024, how your claims have come in, and the orange is 2023. So as we look, this is just an easy way to illustrate that with the exceptions of February, which you can see down here, and June, everything has increased this year versus last year. So again, it's not what we want to see. I think there's a lot of things that we're doing, which we'll talk about to counteract this, but this is just how claims work. You're going to have good years, you're going to have bad years. You need to look back over time to understand where we've been and what to expect moving forward. So this was a rough claims year. You can see that illustrated here. The red is higher than the orange. Thank you. Can we get the next slide, please? Claim summary, again, this is just a million different ways to show the same thing. Claims are up this year. Year over year, total premium increased 20%. Now I'm sure you're thinking, what in the world? There was 11% more members, and depending on where the members fall, family premium is more than employee only. That's why it's 20%. So premium was up 20% through enrollment, but claims increased 59%. So there's a big difference here. And then if you look July through December, which is the same time period that we use for underwriting, last year at this time it was 72%, which led to us having a more than favorable renewal, the 4% versus industry trend of 12%. This year it's 95%. So the claims justify UHC requesting 18.2%. Now it's our job to go back to them and say, we need to appreciate the partnership, the things that we're doing in the future to continue to drive that cost down. Next slide, please. Very briefly, this is the data that we use, and this is our back of the napkin illustrative projection, right? We're not stamping this as an actuary officially. We are trained underwriters, so we understand how the math works. If we were looking at this from a completely, if we were in charge of every dollar for your plan, we would estimate a 15 to 20% increase based on what you would need to pay claims. Thankfully, we're working with UHC. I don't care if they lose a little bit of money, so that's why it's our job to try to get this as low as possible for you all. The next slide. And this is really where it's important to say you're going to have your good years, you're going to have your bad years, but if you look at everything over time, we can show where we're going in some of the strategies. So although you have a 95% loss ratio, UHC is already saying that they're willing to come to the table. So we look going back to 2017, we have every initial released renewal on the top line here. So the initial renewal is 18.2. This is blank because this is the final negotiated renewal. And then the bottom is the loss ratio. So 2023, Blue Cross Blue Shield, Anthem moving to UHC. You can see there is a significant 11% cost savings. This is why we went with UHC. And so I think that's important to look at this through the lens of, because 18.5 year after year, you add 6%, this would be leaps and bounds above where we are today. So it doesn't reset the floor. This is very important to your budget. However, when you look backwards, UHC is still in a better position. If we took the 18.2, then we would have been staying with Anthem. Now, it's our job to make the magic happen from the first row to the second row. We do that through painting a picture of what we're doing on the wellness programs, how we're working to educate rural employees, the commitment to sustaining a partnership like you had with Blue Cross Blue Shield for so many years before they said they didn't really want to keep renewing. But if you look here, UHC is coming to the table. In 2019, 95% loss ratio, initial renewal 37.6%. 2022, 99% loss ratio, initial renewal 28.5. They are accounting for a lot of other factors than just the loss ratio, but if we show here, 2025 planning for 2026, 95% loss ratio, 18.2 initial increase, which is the lowest by far traditional. So this is good news. I think it shows UHC wants to come to the table. We're going to market. We're going to have an open mind. But we firmly believe that UHC is the partner to continue with if they would agree to a more competitive price. But we'll talk about that in a little bit, again, with the wellness incentive programs being the main thing and them supporting your initiatives to get a healthier workforce. I'm saying the same thing a million different ways. This shows our math and how it actually shakes out into your plans. So this shows the UHC high plan right now. You have 110 total employees. That's doorknobs, not belly buttons. So when I open my one doorknob, I got mine, my wife, and my daughter. That's 3 belly buttons. These are just the doorknobs. UHC mid plan, we have 37 participants, and then the low, we have 14. In 2023, it was a total of $2.6 million. Last year, the budget increased to 2.7, really 2.8, we'll call it. With the available credits, not everyone is taking advantage of those credits, but with every credit available, it was actually a decrease last year. But we're going to budget off the hard dollars, so it's a 4.4% increase or $116,000. This year, the initial renewal is calling for 3.2. There are additional credits that we have, which actually brings it down to 15%. But we're budgeting off the top number, 18.2, $500,000 increase. This is what is still in the works with UHC. Thank you for listening to me ramble. We're not done with insurance yet, so don't turn off Mr. Brain. Yes, question. Yes, sir.
What participation do we, of employee participation do we have in the wellness program?
We have that in here.
We don't have a
Why? Oh, I'm sorry.
Are you familiar, is it above industry trend or is it below, or is it about where everybody else is?
It is probably slightly, and I say slightly below industry trend. But in part, I think that's because we started with UHC last year.
Right.
And since, it's a new app and a new kind of way of doing the wellness, so it takes some time to get that traction. We're already well ahead of engagement and wellness from where we were last year, which was the first year with UHC.
Okay.
And so we've already seen some growth this year, and I would anticipate, on next year it would be, even greater.
Are there any programs that we can implement to increase that? Because overall, it's going to say.
Great question. And Stephanie has already asked us to go in that direction. So we've already pushed out the marketing for a wellness program that would hopefully tie in the UHC wellness that's already available, what Kat's already doing, and then have someone managing that to your point, could increase that engagement.
Thank you very much.
Each example is the, mammography on site. So if you get this done and you track it in your UHC app, then you get those points. But I call it the water cooler effect, right? Like we can stand up here and talk insurance, and I'm sure like y'all, you start to get a little drowsy, it's like this isn't the most fun thing except for us. But as people begin to talk about it organically, that's how it spreads, and that's the traction that we're seeing. Justin.
If you could suggest any incentives, down the road, I'm sure we can work.
Absolutely. Thank you.
Thank you.
The laser pointers were, I thoroughly enjoy, but.
All right. Any other questions on medical? Yes, ma'am.
Okay, so on page, I think this is for the high cost claimants, the two that were closed, did those result in death or they actually resolved?
So we don't have that level of detail because they won't let us have the employees' information.
Right,
I'll tell you.
That was closed.
It could just be that they are no longer employed at CAT, or that the employee is no longer at CAT. It does not mean they're deceased. It means that to your point, the case is they're either no longer on the plan or they could have passed away.
Okay.
Yeah. typically these claims,
I don't
it's gonna be hard to see those resulting in death,
Right.
so. Almost always, it's somebody got a new job, somebody turned 26, you know, somebody's spouse got a different job, so.
And the renewal negotiations in 2020 and 2024, we were in the 70s. Do these numbers correlate with whether or not we're fully staffed or not?
No, honestly, it doesn't have any impact with the staffing. It just is really how many claims you had that year. And especially to just one earlier, how many of those large claims. So if everyone's going to the doctor for their regular checkups and all that, that's great, and you'll have a much lower loss ratio. Just some years, you know, as Jeff pointed out, this past year, you had 11 large claimants with a much higher total cost for that. Last year was 7, and we see that, honestly, wellness programs can impact those underlying utilization. You're never gonna be able to stop a cancer with a wellness program,
Right.
any sort of program that
And I
matters.
think what I heard her ask was also, do we have any correlation, maybe from Ms. Cutter's point of view, or knowledge? What was our employment, or vacancy rate during those periods?
Yeah.
Was it high, was it low? If it's, you know, is there a correlation there, is what I,
Because if you have more people working or more people on insurance, then they're gonna file more claims. So,
Not necessarily the
Unless
higher
the-
claims,
but not, yeah, I'm not from a higher, I'm just claims in general that would effectuate the loss ratio.
I will tell you, those 2 years were so messed up, this 2020 around this time. Carriers were scared to death, they thought the COVID was gonna tear through the plans. But then we see in 2021, we were able to show them, hey, that just meant no one went to the doctor. And so they came out with a decrease, so those 2 years, I would say are outliers, no matter, you know, we can look at all the, 2020 and 2021. 2024, so the difference there is, one, the things that we could control, the low cost claims that we use wellness programs for, those were down, and then 2, these high cost claimants weren't on the plan. So the other hard part is timing. If we renew and then a hemophiliac joins the plan, that's $1 million claimant. If we renew before then, it looks great, but the loss ratio looks great, everything looks great, but then we all know that the plan is eating $1 million. So the timing of everything is what makes this very sensitive, which is why, you know, we need to negotiate so close to the effective date. Because that's when they have the most amount of information, and we have the most amount of negotiating power with it.
I have a question about the FTA regs. That they require that we maintain a certain percentage.
No, FTA reimburses Chandler Franklin. 50% salaries and benefits. Part-time employees. And because of that, we have to comply with FTA procurement. Which means we have to, persist in a competitive fashion here. And a competitive fashion.
And that impacts the renewal rate for insurance.
No, that was simply meaning that they offered us hey, if we get the deal done today, we can do a 13%. We said, oh, let's think about it. And Ms. Coach said, well, while you're thinking about it, let me make sure we can actually get away with it. And she was able to find that, no, we would have messed everything up. So that was just noting that UHC is willing to negotiate. Now it goes back to the 18.2 and we do the regular procurement process as the FDA regs specify.
And they can get it down lower than.
Yes,
Okay,
that's still the plan. for
So
sure.
it's just a procurement thing.
Yes,
I got
we're
it.
just going through the
I got
steps
it.
right now.
I got it. Okay, I just wondered whether they were controlling. I got it.
No, we're good.
Yeah, we're gonna follow the FDA rules for sure. Any other questions on medical?
A great question.
Because Jeff and I flipped a coin and he got the important but boring information. I got the important but less boring information. She did try to. Some of the things I'd just like to point out, because I know, y'all only see me once a year, good news this year, you get to see me twice. But Kat, and especially the Center, are doing a lot of great things for the employees, and I point this out also to the employees during their open enrollment. Because a lot of it can seem kind of hidden or built in to the medical plan and beyond. And sometimes if you tap on a list, you realize how great it really is. So and I know you are aware of the, health reimbursement account that is built into the medical plan, where CAP pays the last 1,000 of your deductible, no matter what medical plan you're on. And that can be up to 3 people on the plan. So if it's me, I have a husband and a child, I can, if everybody's going towards their deductible, that's up to $3,000 that Chatham Area Transit is reimbursing, or reimbursing me. I don't even have to come out of pocket. But anyhow, it's called reimbursement. So I mean, that's a huge benefit. So that in, you know, your medical plans, you know, if you've got the $2,500 deductible plan, it's really only a $1,500 deductible plan. And that's a low deductible. That's just a huge perk that CAT is funding. The wellness rewards, kind of back to your question about the wellness program and incentives. So through UHC, like Joe said, if you go get your preventive visits and stuff, then you can get up to $300 back from United Healthcare as the employee, and spouse is also eligible. So a family could all get up to $600. Some of it is, you know, there's a weight loss program, a pregnancy program, so it's not, most people would not get 300, but you can still get 150 or 2 depending on participation. Also, United Healthcare offers CAT a $25,000 wellness fund. And it's really up to Chatham Area Transit how they use it. They've used it for the next bullet, for lunch and learns, where they've had educational sessions on site. They have also done fresh fruit Fridays, where they have picked up fresh fruit and vegetables, brought them in, had them in the break rooms for all the employees. So a lot of nice things that, you know, CAT is really looking out for their employees. Also last year, and y'all may remember me talking about this, we implemented the Adele EAP at the recommendation of the board and Ms. Cutter. And it's a wonderful program. It's run by Savannah Hospice. To make sure people know it's not a hospice program. But it's their EAP, they're local, on site. We've had a lot of participation in that. They offer everything from grief counseling to financial counseling, marital counseling. Really, if you need counseling of any sort, they're there. And they're here in Savannah. We've seen a lot of utilization of that. And including ongoing utilizations where, you know, a lot of people go once and go in the reporting, which I'll bring to y'all next board meeting. We've seen a lot of ongoing utilization where it's one person going multiple times. And I think that's a huge benefit. It's no cost to the employee. And I think that's a wonderful benefit that we've seen used.
We know every time it's the mental, I mean, the EAP program.
We do. It's in their benefit guide. And I know they've pushed out in the past some flyers, and I think there's some hung around as well. And then they've also coordinated mobile mammography from St. Joe Candler, obviously, and also that kind of back to your questions of loss ratio or wellness. That is how we can, that's the only way we can potentially impact those higher claims with earlier detection of some of these things. So mobile mammography is on site. Last year they did biometric screenings. UHC came out and did those again, so you can get a read on your health and get ahead of that. And then the last couple of years, they've done a wellness fair, kind of under vendors in, some, you know, fresh fruit and snacks and vendor participation with giveaways and educational stuff so that all the employees can really understand their benefits and use them. You know, obviously they're there to be used. And so we want to make sure throughout the year that we remind people. So I know all of my clients and our office included, you go through open enrollment once, and then when you actually need your benefit, it's 4 months later, you don't remember necessarily all of that. So we do have the guide that we hand out every year for people to keep. But again, when you're needing something, you're not always thinking about the guide. So we can try to continually kind of re-educate throughout the year.
How about basic gym memberships? Did we do that?
Excellent question. We're working on that. Because they, you know, they do have the gym on site, so we worked with that some. But I understand there's a HVAC unit issue or humidity issue. So part of our wellness marketing that we're currently doing is we will look to see if we can have that gym membership reimbursement. Because there's a couple different ways we can do it. You can take like Planet Fitness and everyone goes there, but if that gym isn't convenient for everybody, it's not really a benefit. So we would be looking to have it built in to where if you go, I'm making numbers, 6 times a month, then you could get $100 back or whatever the cost of the membership is. So we would look for a broader model so that it's more widely available for employees. Any other questions on kind of some of the wellness and benefits for employees? All right. I promise we're wrapping up. The rest is over. The dental policy, this is good news. Last year, when we renewed with MetLife, it was our first renewal, our second year with MetLife. We were able to negotiate second year rate cap of 7%. And so the dental plan, the last few years, including last year, ran really high, again, back to that loss ratio. The loss ratio was 78%, which should call for a 15% renewal with MetLife this year. But because of that initial contract and the rate cap, it's renewing at 7%. And since that's part of the original contract, we don't have to worry about that FTA regulation because it was built into that contract. So good savings for this year. Next year is going to go through that whole process of evaluating again for the dental. And vision is currently with UHC. When we moved it, it was almost a 5% saving on the vision plan. And we also got a 0.5% off the medical when we paired it with UHC. Since we are marketing UHC medical, we're also marketing that vision, even though it's under rate guarantee. So we keep that packaged should we need to move the medical. And then again, your life LTDSP is also under a rate guarantee. So that is another rule that we don't have to go market this year. We moved from Standard to Hartford back in 2022 with a lot of savings, almost $30,000 off the premium. That was guaranteed for 2 years. Since then, they have renewed it for 2 years twice now without increasing the rates. And from what I've seen on my side, and I think some of the executives at Pat would also agree that they've been really good to work with. For some of the things that we need their help on in the last couple years. And then lastly, communication and education. I know I've spoken to it a little bit, but just to give you an idea, we do have those open enrollment meetings every year. But last year we had the UHC representative come down. We had them at the wellness fair and they came down for open enrollment. We do the benefits guide to make sure we're communicating that to everybody. And then also, you know, we really try to educate again, like I said, on the benefits and how to make the most of them. You know, when you're using a preventive visit, doesn't cost you anything. You know, and that's what we're saying, giving those preventive checkups, using an in-network provider so that you can keep those costs down, understanding your health reimbursement arrangements so you know when that will kick in. That sort of stuff. And then we have had stuff throughout the year where I know the CAP has really hung some of that EAP information and on.
We have so many prescriptions for diabetes. Could we do a diabetic clinic and a dietitian?
We certainly can. And I think, did not have a lunch and learn steered towards that within the last year. But yes, we have discussed that because you're right. And CAT's not alone in that. In the South, we see that with most of our clients. So yes, I think that would be good to continue having those educational seminars and someone that they can reach out to. And UHC has a nutritional program that can be built in to that program as well. Okay.
We have a lot of those.
So I will say that is a trend as we've seen as the new advancement of GLP-1s are not new, but the Kardashians made them popular, right? But this is only available for diabetics. So because of that surge, I think the pricing is increasing with the same amount in terms of relative percentage, but the costs are increasing across the board. Really all of our clients across the country, especially in the Southeast, it's just an industry trend where that's going up. That's a big target. There's always new innovations that we're trying to program, but it comes back down to the basic, you know, blocking and tackling, nutrition, watching your stress levels, you know, making sure that we're getting our insulin, getting the reading, taking care of the little things so the big things don't stack up. So unfortunately, that is an industry trend that we've been dealing with the last couple of years.
Yeah. And as much as we want to prevent it, the drugs are expensive, but they are much cheaper than anything that would occur if they are some poison and if it's one of those drugs. And that's all we've got. Unless I've got another question. And I think about CSGO.
It's fun.
Thank y'all so much for everything.
Thank you. All right. Next, we have fiscal year 2026 budget team recognition.
Thank you.
And that'll be presented by our CEO, Ms. Stephanie Cutter.
Good afternoon, the board of directors, colleagues, public at large. I would like to take this opportunity to Our budget team works tirelessly and hard. Mr. Kevin Dyer, he's our budget officer slash accountant. Ms. Gloria Royal, she is the interim CFO. And myself, of course, I'm the interim CEO. This makes up the FY 26 budget.
Right, next we're going to our proposed operating overview, presented by Ms. Gloria Raw.
Can I ask a question before Ms. Royal starts? Mine is more of a formatting question. I think I know the answer. But when I looked at pages 1 and 2, everything was in parentheses. And then in pages 3 on, there were no parentheses. I think I know why that's the case, but I'd like to know why.
One is money,
One is income.
yes.
The other is out.
Parentheses,
Uh-huh.
it's shown as that's how money is shown in the module. And 3 and all of those are expenses. And they're really an offset to the revenue.
Okay. Yeah.
Did I have to do it every line?
This afternoon, we're going to give a brief overview of our fiscal year 2026 budget. And if you would like to follow along, I believe it is after, the information is after tab to the second page. Okay, so we tab 1, and we're skipping over tab 1. Yes, ma'am, we're going to the overview, which is after tab 2. So we're coming back to tab 1. Only if you have questions. This is going to be an overview of the budget. Right. Okay. Okay, we're presenting to you this afternoon the fiscal year 2026 proposed budget. We did prepare this budget very conservative due to the constraints that may occur in during fiscal year 2026. We are presenting a balanced proposed budget of $38,687,890. Of course, our revenues consist of our fares, fixed route and paratransit. Proposed for fixed route, $1,515,000. Paratransit, $157,000. Our agency revenue consists of ferry revenue from the city, our other agencies, Weston and the Convention Center, from Chatham County, paratransit, partner Port Wentworth, City of Savannah, the shuttle, as well as we're anticipating funds for the senior circulator. We've entered into an agreement with the Board of Education that we're looking forward to receiving funding and being their partner in the student path. We're anticipating receiving special district taxes, which we budgeted at 17,934,000. Special district tax, 5,768,000. Our other revenue consists of our programs such as the City Employer Pass Program. We're anticipating participating more with the university and colleges this coming fiscal year. Therefore, we will be receiving revenues for those programs for bus passes or either having the universities have a program which would include their students being able to ride our bus through a tuition fee. Uh-huh.
What do you account the $1 million, almost $1 million decrease in the other funds?
In the other, okay, in others. Let's see.
You have a $958,000 decrease.
Okay, in this one, we don't know if we will be receiving some of the funding that may have been state program. We don't know exactly if we'll receive all of the funding that we're hoping to with some of our partners.
But don't we?
Also, I'm sorry, go ahead.
No,
Also, there are some years where we sell assets, maybe buses or some type of asset. We don't foresee a lot of revenue coming in of those type sales in fiscal year 2026.
but under the special service district, that's a tax. And
That's the transit tax, that's correct.
and did we use last year's budget or did we get actuals from or projections from the county? I'm just wondering how a lot of
Yeah.
these are revenues generated from state or other agencies. And we're increasing all of those, but under other, which we really don't have a specific item. We're just expecting, 30% reduction? Well, no.
Those are
42%.
not dedicated funding sources that we have for that. We do not have a dedicated funding.
And the
source.
others are all dedicated.
The others are dedicated,
Thank you.
yes. Yes, ma'am.
Have we looked at all of our service contracts to see if they're paying for themselves?
We are looking at the cost, we have looked at some of them and we're in the process of looking at the others to make sure that we are receiving the accurate amount of funding for the operations that we're performing.
Because the ones that we're got a deficit on,
Mm-hmm.
we need to see, that needs to probably come back so we can have a conversation about it.
Yes, ma'am, I do understand that. I know that, some of the, contracts we are reviewing at this time to make sure that we actually receive enough funding to cover the expenses. Mhm.
And have what's our cost per service hour?
I don't have that in front of me, Ms. Cutter, if you have the
I
copy.
to remember, just recently completed the cost analysis because we had to, of course, reply to court Wentworth. I'll have to look at my spreadsheet prior to the meeting. I want to give you the exact. You have to reply to them about what? The agreement in FY 26. As you all know, it was partially subsidized, but in 25, But, it cannot be subsidized in 26. But, there may be a service cost reduction, because Port Wentworth is saying, they're only budgeting $410,000. So we're gonna have to go back in the actual cost for the service that they currently have now, paying out to $521,000. So we're gonna have to submit to them some alternatives, to work within their budget.
And the, one thing I was gonna ask was about the, agency revenue from the universities. Because when I looked at the line item for SSU, there is no budgeted amount, so these contracts we're gonna work on.
We are,
I'm looking on page one, exact. So it's there, but, there is no budget amount for 2026.
yes, ma'am, we do not have the budgeted dollars there. But yes, it is our plan to work with the universities, first to make sure that they are interested in working with us and they want the service. And then hopefully by the time we're ready to finalize the budget, we will have numbers.
And then the, where does the advertising revenue, somebody advertises with us?
Well, currently, we do not have any advertising.
I saw
revenue. It
the
should be-
line item.
I think it's a zero there.
Yeah,
If
there's
I'm not
nothing there.
mistaken.
Yeah.
Yes, it's from prior year when we used to have advertising on the buses. But currently we do not. We do not have any revenue coming in from advertising.
And then the line item, I was looking at 490 to 493. And then 440, 190.
Yes.
They look to be the same. There's no budgeted amount on the 440, 190. I just need to know, it's smart, fair smart. And the numbers of the descriptions the same, but the object number is different.
No, it's different. It's 20 ride,
And 10.
10 ride, and 31 days, 7 day.
Come down again. If you look at 490, that's what it states. You come down to
Right.
40, 190, it stays the same.
What is
I think it's
RECH?
It's a recharge card. It's a type of
Recharge.
pad that they're selling and we have it listed by the type of pad.
Okay.
Even though it may be a 20 ride.
But I have a question about that, because we got some complaint about the way the rides are taken off of the passing. And that the day passes, they're gone just by the calendar and not the number of days. And they're saying that, they don't get to use it for the 7 day week because it's not 7 days. It's a calendar.
Okay, I would have to write your question down.
Okay.
And research on that, probably not.
Before we move on, I request that in the future, on the actual budget page with the one that she was just referring to, can we see a column at the end that's a percentage
A percentage.
of increase or decrease? I mean, it's just easier to see those red flags than to have to go through every number. When we see 100% increase, or whatever.
The final document, you will see that percentage.
But it would be good to see even on the proposed, only because, if we're seeing a 100% decrease in revenue, but we're seeing somewhere else, we're seeing 100% in expense, those are going in the opposite direction. So it just help me out.
Yes, sir. We have another workshop planned for May.
Right.
By that time, we'll have more information in. You may see where there's zeros now, you may see some new projections. So once we are at that point and feels that those numbers are good and consistent, we will have that percentage.
Thank you.
And And having said that, I think what I heard was that we were presenting a balanced budget. And I'm thinking we've got all these unknowns. Is this really
It's
as
not,
balanced to the point that where we are?
yes,
Okay, but it's
That's
not the
correct.
final, it's not the
that's
final.
correct,
And,
that's correct.
and I have another question that's been an ongoing conversation that I'm hearing is about Sammy not paying in. And I think we're supposed to be I heard we was working on getting them to pay. Will this line item increase based on what they owe us from?
Well, we are still working through that. Uh, it is my understanding that the city, along with the chamber, because that's a share of PR fees, and that's driven by the city of Savannah. And what happened with that is, I believe it was in 2017, under new administration, they repurposed that money that was going to support the ferry system. They reallocated those dollars to downtown services. When it was questioned in 2021, that was the justification. And that agreement has not been updated post-COVID. So it is on the table to update that agreement, because there is supposed to be a true-up at the end of the fiscal year. And any monies that were not covered by the POR fee, then that money has to be made up by Sammy, City of Savannah, Chamber, Convention Center is a part of that according to the contractual agreement. That subsidy should not be on the backs of Chatham Area Transit Authority. And those discussions are occurring.
So would it go back to where it was in 2017 when we were getting the money, or? are we looking
Now
at something different?
that part there has been no definitive answer regarding that, but that will be a request.
And I got one last on your income statement. It's about the semester passes with I think it was $300,000. Yeah, who is that? Who is it? What, is that a school or?
The semester passes are for the schools, and this is another program that we are hoping to get participation in. In the past, we would work with Savannah Tech, I think it's college now, Savannah Tech. We will work with Savannah Tech with the semester pass. And they will purchase the passes from Chatham Area Transit in addition to their students.
So semester pass is specific to Savannah Tech,
It's
and the
not,
other one.
no, ma'am, it's not, any school could actually purchase. I was just using that as an example of who we worked with in the past.
The only reason I asked because I saw that line item for Savannah State separately. And there's a line item for GSU separately, and then it's the semester pass. I was wondering.
And there's Savannah State and
Georgia.
Georgia Southern, their program was basically the same. They're the same. Savannah Tech was different because it was on a semester school item and they were actually issued their pass.
Ms. Gloria, where is IT?
Department 16 Administrative Services. They are part of.
What
that
page?
particular budget.
That's page 7 of 14.
Yes,
And what are they asking for this year?
actually, all that's been asked for, and let me just say this up front, there is this particular line item, there will be cost savings because currently the system that we are working with, which is Clever, which is TripSpark, which is Trust Farm. This particular software program is going away, and it's gonna be replaced with Clever. However, we are uncertain when that cutoff date is. Therefore, we have allowed costs to be included in this line item for, I think, 3 to 6 months in this line item. Because we just don't know what the cost will be. But we will clean it, It's just
They're asking for more than that, correct?
no, they're
Or
not, it's
just
gonna be
that.
less, it's gonna be less than that in this line item.
Which line?
In the contract services,
That's not, the contract services is not Xfinity.
I would have to go back and
They
drill
are
down on
part
it,
of
because
that. With any monthly charges that, we pay Infinity, they are a part as a regular operating. Now, there are capital costs.
Right.
When you all get the, 5-year capital plan, you're gonna see, any capital related IT costs. We have not captured all of them yet. We are still waiting on not only IT, but safety and other bus stops and other capital amounts. We are still getting quotes and bids and all of that. At your next workshop, you will see what that number looks like. It will be shown in the 5-year capital plan. Later on in the presentation, you're going to see what the priority capital projects are for FY 26. You're going to see a summary of that. The purpose of the workshop today is to solicit feedback from the board, any items for inclusion prior to the finalization of the budget document. So we're
Right.
going over what we have now. When we come back before you in May, you'll see some more numbers on the revenue side and on the expense side to allow us time to see what that impact is on operations for example, IT. Switching from AT&T to Sumitomo. Those things are still out there lingering, and we don't know what it looks like now.
But they gave us numbers in January when we had the IT workshop. And Xfinity put in for 400 grand for the IT workshop. So this 400 and some odd change is understandable for contract services. But where is the in-house stuff?
Now, you're gonna see contract services throughout your budget document. You're gonna see
Right.
it in other divisions. You're gonna see it in planning. You're gonna see it probably in fixed route. It's spread out because it's just not what you're seeing in 16 is mainly reoccurring costs, whether it's AT&T, whether it's Infinity. And for further clarification, at the next workshop, we'll break it down what this number represents so that it'll be more clear for you.
But I still answer her question, which was, what is the in-house? Is there anywhere in this proposed budget that captures how many people do we have in-house IT?
Right now,
One, where is that captured?
in the
Yeah.
salaries, in this
In which one?
16.
Yeah, but
16 what? What organ?
Administrative
I know
services. That's where his.
so you're talking about the 51,200?
Administrative services, they don't.
Administrative services.
I know that's 16. I'm asking which object, which account is it?
51,200,
200, thank you.
yes.
So they are in the $407,000. So we're. Okay.
that seems like they need their own, section. And
what all is captured in admin? Under the 51,200,
Administrative services, there are multiple, positions budgeted, in there. Currently, procurement is a part of administrative services.
yes, ma'am.
IT is a part of administrative services. Trying to think of what else.
But you, this said, when we come back, you have it all spelled out so we can see it.
No, that'll be broken down as
And
well.
any other,
Whatever else.
requests, it will be as your questions will be responded to at our next workshop that will be held in May. And the purpose of that is to make sure that we are financially capturing
Right.
all of the priorities and expectations of the board.
If we could get those, especially wages,
Yes.
benefits, they're gonna be, we don't really have a lot of control after we approve the budget, but the wages, I would like to see broken down for each category. What those are.
But under IT, they have costs that are not capital costs
Right.
that I'd like you to outline.
Yes.
And what those monthly service fees are. And some of the Xfinity cost is over in the call center.
Yes.
So it's not really,
We'll detail it for you so that it's clear. And where the IT costs are, by division.
Will it stay under the same 51,200 or have a subsection?
Well, what we're gonna do, we're gonna bring it back by division, so that you all know what the contract services, IT, what those expenses are, and to whom the vendor is. We're gonna bring that back.
and let's outline individually what's in the capital
Yes,
budget.
yes.
Because there was some confusion about what was included in the 1.8. I'd like to have that outlined.
And the other thing too, for me, is where we say other, like on, I'm back to page 1 to the income. When we said other, RE lease, is that something other than Greyhound?
That was something in the past.
But it's got a dollar amount.
What, I'm sorry, what page are you on? You said REV?
I'm on page 1.
Page 1,
And it's item 46,150. That's the object number. Other REV lease.
that is great.
That is great.
That is great.
Can we say that? Can we say that? Because I was thinking, because it said other, I thought it was somebody else.
Yes, that is great.
I wanna add one thing on the service delivery contract. I would like to see, the total number on the contracts and, like a P&L statement on our profit and loss towards those contracts.
And on page 2.
Now remember, as we bring this information forward, particularly as it relates to profit and loss. Some of it is attributed to long-term, old contractual agreement that really has not been addressed yet. For example, we know that Garden City is heavily subsidized. So and that was because back in the day, a lot of industry was a part of Garden City and covered some of the costs of public transportation in Garden City. Currently, right now, every property within Garden City is not necessarily taxed. That's why it's subsidized. But that's something that is also being worked on. So don't be surprised when you see the revenue from whether it's Garden City or Port Wentworth or any other municipality, that it may know, because it goes back to historical agreements, and these agreements haven't been updated for a very, very long time.
When you say a very long time, I'm sorry,
No, go ahead.
are we talking a year or two? Or
No, I mean,
help me understand why we're using the terminology for a very long time. Why?
because it has been a long time.
Well-
We're talking about from probably early seventies.
Okay, I guess my question is, did we talk about this last year? I wasn't here. Did this come up last year, and why have those contracts not been looked into? I mean, when did we notice that these contracts from the seventies we're just now talking about
We had a workshop
it? Okay,
where we went to the
when,
county.
when was this?
This was last year, where we went to the county to discuss these particular contracts. Because the Garden City contract, one neighborhood in Garden City opted into the transit tax. The other half of Garden City did not opt into the transit tax.
Okay,
So they wanted to pay for services out of their M&O budget. Port Wentworth refused to opt into the transit tax. So they wanted to pay out of their M&O budget. So they did these contracts that now may not necessarily pay for themselves
last year.
last year.
Fort Wentworth was last.
That's what we're talking about right now.
Yeah.
And Garden City, there's an issue with the zoning because the neighborhood that is being taxed twice. Really 3 times because they're getting taxed twice for the transit and they're getting the regular tax. So that was supposed to be fixed by county.
So are these
Or-
negotiated through the county or through CAT and the municipality?
They were negotiated between CAT and the municipality, but the neighborhood that is being overtaxed opted into Chatham County's transit tax. They did a referendum and opted in.
We call it governmental. What was the initial for the contract? What were they called?
Probably
Intergovernmental, yeah,
Intergovernmental.
and we,
Okay,
okay.
And and this is, I think this is my last one on this one.
Andrew, I know, since I've been here in the conversations, as it relates to these issues, attorneys had differences of opinions as to how, the assessment of the tax, the steps needed to, move forward with assessing it. So is that correct? There is a lot involved with that because it requires referendums, some states it didn't. So that's kind of been a part of the holdup, the municipalities, the county, coming to agreement of how that process really works.
thank you.
On page 2, we talk about, well, Port Warford specifically, we are proposing 610. That they have to pay us now, because we said earlier, 410 is
200 is for capital. And they will not pay the capital until we get all of the bus stops installed.
but we're budgeting 610.
The 410 plus the 200,000 for capital.
Right, the 410, but on this, when I'm looking on the spreadsheet, it says 610, so it's an additional 200.
Yes, for the bus stop improvement.
And we said we approved 600,000, but we only collected 410. You said in 20,
No, for
2025.
FY 26, we are projecting 410,000 for transit service, plus 200,000 for bus stop improvements.
got it. But then we go over to FY 2025 approved column,
Mhm.
it said we approved 600,000. I'm on page
We
2,
did,
but we only collected,
we didn't get the money because we haven't, made all of the bus stop improvements yet.
but what we got was 521,000.
Last year, the contract amount, Rita, do you remember what that contract amount was for Portland One?
It was 400, it was 400, it was
Four
400,
even.
it was 4
400,
even.
four
Because
even.
at the time, the allowance was $52,000.
That's right.
And it was initially evaluated based on it being an addition to Route B3. It was gonna be an extension of Route 3B. And then they requested an individual route and a bus, which increased the cost significantly. And we didn't go back to them when they requested the individual bus and the individual routes.
And I think when, our consultant came back and did a presentation, that $52,000 was discussed. And really, that was a negotiation strategy. And, that came out, in the workshop.
It did.
And commitment to this board was that if there is a service in Fort Wentworth, wanted to continue a service delivery, they would have to pay the actual cost per service hour. And that's what, the FY 26 budget will be based on. They have said that they are budgeting $410,000. So the service will be based on the cost per hour. That totals 410. So we're gonna have to make some changes.
The original evaluation for that route was to extend 3B so that it was cost effective. Is that still an option?
That's still an option.
And, I'm sticking with the budget on page 2 again, where we have, capital contribution and contingencies for 2026, there's no money there.
Yes, ma'am, we will have that. Capital contributions
Yeah, and contingency, there's the,
and contingency. We will have that if you flip back to.
yeah, I noticed, yeah, here's on page 7.
Summary, right?
Right, the summary is, yeah, I look at this and then the
Okay.
summary, yeah,
No, it's on page 7.
on the summary,
I'm going to page 7.
yeah, I know, but.
Right here, no, it's the other, he's,
For contingency. in-
uh-huh.
Mhm. So why is it here?
You see it in the middle of it?
And it says one, was that 1
It
million?
should be on the Department 17.
Yes.
Yeah, so,
Department 17.
so what am I looking at here that has no money to it? It says, this says, department or organization 1001, object 49999. That's different from,
Contingency is not revenue, Dr.
Right,
Robinson.
right.
We really will be, removing, those line items from
Okay.
the revenue side.
Yeah,
They're covered on the expense side.
right.
So each department does not have a contingency budget?
No.
Mm.
We're treating contingency in a department like a interdepartmental. It's there to address, transit needs that come up that we did not budget for because we had no knowledge.
And it may be any department.
Yes.
Is
It may
line,
be something the board comes up with that they would like to see occur, whether it's a additional bus stop, a bus stop improvement that we didn't have enough money for, those type of things.
Possible general expenses, that's correct?
Yes, sir.
line item 58,150, training and registrations.
Oh, yeah. I know.
Is that training for everybody? Or is that just for admin
Dr.
service?
Odell.
No, every department has that.
Every department has a
Every
training.
department, if they request it, we have been pushing staff training and development.
Right.
And have encouraged departments to make that request. And now that we have our training division on the operations side, staff, we will be having the administrative position filled in the near future as well.
Cause 5,000 seems low.
It's budgeted, if you look at what was budgeted last year, departments are just not, they're just not using it. We are putting the money there and we are encouraging them. And we'll be bringing, training in-house, more training in-house. That's already started. So you'll begin to see the difference. There's going to be some, we already have implemented some mandatory training for managers and supervisors. Some of it is online through webinars. We have an agreement with Mineral. They offer excellent training. And department managers have to have that training complete by the end of the fiscal year. So we are really paying attention to that.
And I'd like to see, monies put back into 53-101, which is professional fees for the board. There's no money there for 2026.
Okay, well, that's, just let Ms. Dumas know and we'll work on that too. Ms. Dumas, which line item did you include the board professional fees?
That is currently zeroed out. That's 53-101.
That's what we talked about here.
On page 5. And there's no money budgeted for this fiscal year, upcoming fiscal year, due to the proposed legislation
It was left out because of.
that was removed from the legislation.
There's monies, however, in the other training categories.
Okay.
That's all that went up.
Well, all I'm suggesting.
But we'll address it.
Yeah.
We will address it, Dr. Robinson. Just share the specifics with Ms. Dumas and we'll make the necessary adjustments.
And then the other thing, and I hate that Andrew left, but when I looked at the budget, it looks like with somewhere within fiscal year 2025, we gave our attorneys $100,000 raise.
Right.
Did we do, because, and then now we're asking for the same 300,000 again in 2026.
So that budget was reduced.
Well, it says 300,000.
From 24 to 25.
Where are you? With attorney fees, where is it? It was,
Page 3.
page 3, right? Yes, on page.
For legal fees.
Uh-huh.
If it's 24.
It's budgeted for the same amount as.
Yeah, as last year.
So,
And it's managed. You never know what's gonna come up that requires legal attention.
I got
But legal fees is being managed. Every time we have to rely on legal to intervene for whatever the purpose is, there's a cost associated with that, but it is being managed.
well,
If you all would like a report on to where you can see the trend, we could provide that for you.
but I guess help me understand the columns then, because we've got FY 2026 proposed 300,000. We have FY 2025 projected was 200,000. We have FY 2025 approved was 300,000.
And the actuals are 260, so it's pushing 300.
Okay. So what we're doing is to cover ourselves, we're gonna go ahead and project, propose 300,000 in attorney fees. Yeah, I think we need to look at it and we need to see, you know, why we have to pay out this kind of money and attorney fees. When I'd rather see that money go to employees, but I just think that's a lot.
Are we doing retention bonuses this year?
For, well, now the other thing, now that was another line item I didn't see. I didn't see a line item, but I didn't see anything for incentives. What page are you on? So I tried.
I'm on 3. I don't know where incentives are.
Because I'm hoping that a part of our wellness program is to start to incentivize our employees that do well.
Where are,
That's exactly right.
where are incentives? Where's the budget for
We
incentives?
we don't have, everything we have right now is in the wages category. The money is there, we're not pulling it out. I think the board needs to be aware, we don't know what we're gonna be getting from the federal government, next year. Every week, they're announcing they're cutting costs. Now they're telling us that our formula funds, they're not going to touch them. But our competitive grants, a lot is gonna be cut. So this budget is conservative. However, there is monies for wage increases. There is money for retirement enhancements. There is money for wellness. And of course, as you heard today, not only medical coverage, but our insurance coverage on our vehicles, our fleets, our liability, it's going to be, and we have to be concerned about some costs you have to keep year after year after year after year. And the goal is to make sure nobody loses a job. The goal is to continue our commitment to competitive pay and benefits. And as we get further into the presentation, I'll be going over some things that we are trying to do to ensure that we are competitive in a very, very unknown space as it relates to revenue that's coming in. It could impact our transit tax amount, the city, the county. They're seeing federal cuts. When they're seeing federal cuts, they're going to have to cut some things. It's a ripple effect. So we are trying to be financially smart to make sure that whatever is adopted in the budget will not force us to lay off employees.
I'm sorry.
Let me ask this, please. Professional fees for government related, that's a lot of, that seems to be pretty high from what we're getting.
Well, and again, is that a 12-month contract?
I believe we're in the second year, is that right?
But what-
Last year.
Of a 12-month contract? No, it came up before on the RFP and it was thrown out. Yeah, because the previous CEO said that something was wrong with the process and we never revisited it. But it was up for the RFP and it was an approved RFP to move forward. But something happened in the process.
So even during that time, we were still in the 5-year contract with them.
Right.
The former CEO was looking to end the contract.
Try to end early.
They was doing an RFP.
Okay.
And so, but now this year, due to signing.
But my question is it a 12-month contract?
It's yes, for with renewals, it was 5-year contract.
But I think based on what Mr. Luck
That's it, Bob.
Lockett just pointed out is that they only work for us for 4 months. So can we adjust it where we pay them for 4 months and don't be writing checks when they're not working?
Well, right now you have a contractual agreement.
No, I'm saying as I think we need to rethink it.
And that's a board's decision. That's the board's call.
continue this conversation.
Did you not
Ms.
say-
Roy, would you like to have a seat while we?
We got you, are you hoping to stay?
This is the last year for that.
Yes, you are.
I believe it is the last 26.
So we gotta go through 26.
FY 20, let us confirm
Okay,
the contract expiration date.
okay.
I don't want to give you a bad thing.
Right, we don't.
That was a good
I
point.
wasn't really involved, so I'm really not sure what the end date is.
And in addition to the Senate, and you may have to help me, I think we need to, is there money in here for safety? For our fleet,
Security.
Yes.
Security.
but not necessarily security for our fleet, you know, because we talk about the rise in attacks on drivers and that kind of stuff. You know, but do we have, are we putting extra money in safety?
And see, these are the kinds of things I'm talking about that's going to be a capital cost.
Uh-huh.
Because we're gonna actually have to retrofit all movable rolling stock. The union brought up that to us, a concern.
Okay.
And that's something on the table to retrofit the buses. Procurement is, they're doing some research to determine what that actual cost would look like in the actual enclosure
Mhm.
that we will be retrofitting the buses with. And that's a part of capital as well, that will have to be funded. If we can't get grant funded for it, and it's something we don't need to wait on,
Right.
we're gonna have to use general fund dollars to do that.
And I think if we keep talking about federal dollars being cut, then we need to start setting some priorities,
Yes,
you know, outside of that money.
we're gonna talk about that in a little bit.
There we go. Gotta be prepared.
Okay, does anyone else have any other questions? If not, at this time, our interim CEO, Stephanie Cutter, will present to us our fiscal year 2026 operating and capital plan priorities.
Thank
Okay, this is the part where the board's feedback is really needed. These slides were prepared based upon what we see the critical challenges are. I'm on the slide critical operating challenges and risks. One risk is the loss of local, state, and federal funding. There's still a question mark there. And it impacts service delivery, which means we will not be able to meet our community needs. So that's a great risk. We are working with an aged fleet that we did not have a financial plan in place to replace this depreciated fleet, which means our service delivery will be unreliable. We are making provisions within the 2026 capital plan and beyond to address this issue. Public transportation safety, we talked briefly about that on our buses, our ferries, our vans. We are concerned about safety of the public and staff. These are critical operating challenges and risks that we're going to have to do something about in FY 26.
And what I guess what my concern would be the, you said unreliable service delivery. So, and that means that we cannot get our people where they, like our motto say. So that to me, see, that's what I'm saying by setting priorities. Whatever dollars you got, you know, and first of all, if you don't have drivers, I don't care how many buses you got in the fleet. You see what I'm saying? So I think we need to really consider, even if we're getting federal dollars, how are we gonna handle these critical areas in a way that we don't impact our, service delivery, nor do we underpay our employees.
And Dr. Robinson, that's been a part of the financial foundation for several years now. And that's why there is always a push to have that reserve account, because that account is there to help you during low revenue periods. And even in this budget, as we go through the slides, we're gonna talk about that. Next slide, Aria. It talks about all of these proposed priorities. And it's up to the board to determine if these are the priorities that they want the FY 26 budget to focus on, and the FY 26 through 30 capital plan to focus on. We're talking about service reliability, fleet replacement, customer care, building security upgrades, internal compliance review, staff training and development, employee benefits and wellness, salaries and wages, policy review and update. These are a list of priorities, and listening to the board that's listed here. Now is the time to share feedback. You have a notes page that anything you would like to see amended to this proposed budget. We need that feedback. We need your feedback so that we can turn this around quickly and move towards finalizing the budget.
Ms. Cutter. Well, not Ms. Cutter, but the board. I think that salary and wages should be in the red. I think that's been our number. We cannot staff our call center. We cannot get enough drivers. There's gotta be a reason. Either they just don't like us or we're not paying enough money.
We're gonna get.
So I think salary and wage should be one of those top priorities that should be in the red.
Next slide. Budget at a glance, the revenue challenges. We are working with the city of Savannah. They have committed to restoring funding for single circular. But here again, they're going to be looking at operating cuts as well. They may or may not, but that's something we are hoping that we receive funding for. We have a application in for 5310 funding to continue to fund our CAT Connects program. And then, of course, the UPass program. This is another opportunity to bring revenue into CAT to help us to meet these priorities. We continue outreach and discussion. Our fair revenue, we hope to see ridership growth through improvements in our service delivery, our federal, state, and local grants. Of course, we relying upon our formula grants that help us pay for operating costs, operator wages and benefits, and preventive maintenance to our vehicles. We hope to see opportunities for competitive grants that allow us to continue to build our inventory of buses. We hope to see the Transit Trust Fund continue in FY 26. And as I mentioned previously, application for the $5310. We have requests in for congressional directed spending for fixed route buses of $5 million, and the dock at the west end of River Street, $1 million. There are opportunities, capital opportunities with the upcoming SPLOST 8 if it passes. With that, per board recommendation as to what they would like to see requested during the SPLOST 8 process, here are some items: buses and paratransit vehicles, ferry addition, shortfalls, that may arise during the construction of the paratransit maintenance facility and the ferry maintenance facility.
Ms. Cutter, let me just say this, I was looking up at the riders growth in ridership. Maybe something we need to think in terms of how we can be creative to, increase our ridership, I don't know if it's a park and ride or. You come with something creative to,
With the congestion downtown,
that,
I think that's gonna be mandatory. So that is something, on the plate as we develop, our site, on both sides of the river.
And Splash only handles capital needs. Because, and when we say fair, we're talking about another fair in addition to the three we already have.
With the expansion of Hutchinson Island, the new development on Hutchinson Island, getting people to work. And back and to work, and residents crossing the river. The traffic congestion is an issue. In Savannah, not only Savannah, in Pooler and other municipalities, that are growing. So, public transportation is really, going to address a critical need for this city. So we should begin doing it.
Are you planning for, what, a fifth ferry or a fourth ferry or?
This, now remember, you have, two more that'll be coming out of service. Now, you all are gonna have to set, these priorities and this list. These are only some things that management has identified as issues.
But I'm thinking that when management identified this, did we consider that some of the older ferries have not run their useful life? Based on FTA, we have to keep them in service. So postponing a new ferry wouldn't hurt us.
Well, this may not be,
What do you say?
SPLOS is 6 years.
Right.
During those 6 years, we will have ferries that their useful life will be ended. And we're gonna have to replace them. You can't wait till last minute to talk about expensive rolling stock. We have to plan financially for it. We have one opportunity to present a list to Chatham County as to the capital needs of Chatham area transit. If we don't start financially planning now, CAT will be in the same predicament 4 or 5 years down the road that it's in now, with depreciated vehicles and struggling to find money to get rolling stock in.
Now, some of this issues is not about postponing, it's something about the same thing not getting done the way it should get done and the manner it should get done. It's why we're in some of these fixes that we're in. But my question is more about, in order to 6 years from now, have we done some kind of study that said we're gonna need 7 ferries on the river?
It won't be 7 ferries. This will be a replacement ferry. And Jim Ritchie of WRA, the board approved a ferry transit development plan that he presented. And it included the needs and cost projections and all of that. So we take that information and we plug it into our capital plan and try to identify a potential funding source to meet them.
So how many ferries are we talking about total?
We currently, the old ferries, what do we have, 4? We have 2. So there will be 2 additional ferries that will need to place within 6 years.
So we're talking within 6 years, we'll have four new ferries, or not new, but So are we looking at just a total for us to be proficient and efficient, Chatham Air Transport will need 4 ferries running all the
It
time.
may be more depending upon the
what I'm
development
asking.
plan of
Yeah.
Hutchinson Island. That's what will drive, it. And of course, funding.
So within Splash 8, when we say ferry addition, what are we asking for in Splash 8? How many fares are we asking?
No more than, well, me speaking, I'm thinking about the replacement of the 2 that will be fully depreciated. Also keeping in mind that growth and development on Hutchinson Island may require more.
So when we go and ask for money for Splash 8, we're asking for how many ferries?
No less than 2.
So we can say that and be okay, we say no
Well,
less than.
I've asked for the board's feedback.
Mhm.
Whatever, I had that in a executive update, asking for the board's feedback. And because the board will have to advocate for whatever we submit to the county for SPLOST. It's not, I can only bring forward recommendations, but it's not the ICO's decision, it's the board's decision upon what they see as capital priority. These are just suggestions, and you all think about it. Because I'm sure the county will be calling for a SPLOST list in the near future. And we have to submit that list or we'll miss out.
But there's no guarantee that we'll get on the list.
That's exactly right. If the board doesn't advocate, that's exactly right. The last SPLOST 7, Cat asked for 20 million, we got 10 million.
So, okay, but that's a whole nother discussion, maybe I'll hold off on that, because there's some terms that I'm not clear on. As far as getting the money for Splash 8, but that could be another discussion.
That's the question. Didn't you say you did a study?
Yes, WRA did a transit development plan as it relates to ferry services. Mr. Ritchie presented that plan to the board. It may be a good idea to bring him back at the next workshop.
Or let it, or give us the plan again.
You all should have the plan.
Well,
It was
but we
distributed.
got new members too. I
Yes.
may not have the plan.
Yes.
That's what I'm.
We didn't approve it yet.
No.
But there was a study and it had been already, but the study's been done. The study's been done. We have not approved the plan. We've not voted on it. Right. But there has been a study. Yes. Yes.
Well, in that study.
We just need to,
We just need to actually go and study and approve the study. Well, but it is approved. But the other thing too, you gotta also think about things have changed a lot. As far as cost and you know.
I understand that.
Yeah.
The thing is, if a study has already been done, let us look at that study and see if we can or cannot come forward instead of just be able to this. Because we can't answer it, so let's just move forward. We can get to the next place.
But yeah, and again, like I said, this is something that I would want to revisit. That's what I said earlier,
Yes.
that I would want to
Yes.
revisit this, because I have.
We need to revisit it.
Yeah.
Which is good.
Yeah,
And I think it would be good to bring Mr. Ritchie in so that the board can take action and have recommendations as a part of the capital plan that you all will be adopting this year by June 30th. Next slide. FY 26, we're projecting transit tax revenue to increase. We are projecting service expansion, and we are expecting fare revenue to increase. Along with that, expenses, we are projecting increases, insurance, significant, competitive pay and benefits, implementing career paths for employees to enhance succession planning and retention.
And of course, capital and operating, dollars that will be needed for a local match and to supplement any operating needs. And lastly, fleet replacement needs.
And Ms. Keller, either Ms. Doctor, when will the county be approving their budget? When do you guys have budget discussions? So we go before they make their final.
Our budget, for paratransit services, the request was due February 28th of this year. They have, the request, and they are, going through their budget processes as well.
As we speak.
Yes,
They start their budget meetings in May. Next month, May, first Tuesday in May.
And then awards will be.
yes. We'll know exactly what they're going to, what funding they're going to provide for CAT. The next slide it just depicts your, largest category of revenue, and that is the, transit tax. That's the largest source of, revenue that comes into CAT. Next slide. As you can see, expenses are not increasing substantially. We are being very conservative, investing dollars into those priority areas. Priorities include, of course, as has been done every year. We've enhanced benefits. We've given, pay increases. That remains a priority. Also, of course, what is priority, and I'm sure you all remember Dr. Maney stressing the need for additional rolling stock and retrofits to enhance driver and public safety.
And we see a decrease in contingency in FY 2026. There won't be that much money in contingency.
Well, we had to balance the budget. So we are, rather than take it out of, benefits and the unknowns of what the insurance is going to be. That's what we did. That was a balancing strategy. I think we need more in contingency. But right now, it's a balancing strategy to bring forward a balanced budget.
And we look at current operating expenses, I think it goes back to a previous question. It also reflected of the number of employees that you have, because I think in the call center, we're really way down in
For vacancies.
So
And was there two in front, in processing?
All by next time.
Yeah.
Did we submit a SLOSS 8 project list to the county?
Not yet.
not yet.
Or will we see it before you send it?
That's what I'm asking you all to provide feedback on, so that once they request the list, I have the list to submit.
Because because these 4 items is the one that the staff is recommending for SPOS 8.
Yes. And any other items that you all deem appropriate for moving forward. Okay, next slide. Succession planning opportunities for career growth. Of course, training and development, non-union position classifications, a career path where we are recommending levels 1, 2, and 3 for the following positions: transit customer advocates, clerk positions, technician positions, deckhand positions, captain positions. We are currently entering union negotiations, and as a part of negotiations, the union will be bringing forward their ask as it relates to the labor force, the union labor force. Next slide. This slide depicts what we've done, each year in trying to enhance benefits for our employees. In 23, we did enhancements to the, medical plan by, paying, 75% of the cost in lieu of the former 70%. Vision, we had upgrades in 23 and 24. Now CAT pays the entire cost of employee vision. In 23, there was a set aside of $80,000, $80,000 for retirement enhancements. And in 26, we are adding additional funds, and we'll talk about how that will be done further in the presentation. And of course, we've increased pay each year.
Was there federal holidays? What is it?
We added 2 holidays, one in 24 and one in 25. Juneteenth in 24 and Veterans Day in 25. Okay, future FY 26 and future benefits. One thing I noticed is that we do need to make and strengthen our retirement. Bringing forward a recommendation to invest $1,000 in additional investment in the 401 retirement plan. Currently, employees enrolled as of July 1st, 2024. In addition to the $2 for every $1 the employee contributes, with a maximum of $1,500 per person, and 5-year vesting schedule for CAT contributions. A recommendation is coming forward that we make a one-time deposit into the employee's 401 retirement plan. Administration, it's $1 for dollar up to 3% of salary max. The 457 plan continues with voluntary contributions. I think as we move to provide a financial plan for employees after leaving CAT, once they've invested years of service, I think this is a step towards getting there. We can't do everything at one time. And we're going to try to make it better as we move forward. Our future benefits currently being studied. Employer assisted housing program for home purchase and repair. And of course, this is income driven. Meeting with the city about this opportunity, how we can help employees. It came to my attention on last year that we had some employees that were homeless and needed this type of assistance. And of course, there's criteria for vested employees to help with down payment assistance, full time, and there are other criteria. No disciplinary action for 6 months before participation. There are income limitations, and of course, in additional, there is a plan for priority rental opportunities within new development. Next slide. This slide is really just an overview of FY 25 year-end projections. We project at June 30, 2025, we'll have $22.2 million in the bank. With that, we have restricted those, we have restricted funds of $3.5 million.
Of course, we need money in the bank for FY 26. Startup, we're projecting at $9.6 million. That is 3 months of the proposed budget. As this budget increases, that number increases. Currently, we are fiscal year 25 savings of $575,000. Total restricted funds, 13.8 million. Leaving projected unrestricted funds to help us cover some other things. There's a recommendation for 2 million going into the reserve account to help us over the next few years if we do show a significant decrease in federal funding. And of course, operating reserves to help us to fund the cost of operations. Next slide. And the last slide is an overview of some 2026 capital priorities. We have the bus stop enhancements currently underway. We have the security upgrades currently underway, and we have renovations to both Pat Central and the ITC underway. The additional priorities for 26, of course, is the Plant Riverside dock. This is our second time releasing an RFP. The last time it came in way over budget. I anticipate that it will come in over budget again, projecting even with congressional directed spending of $1 million, we still may have a shortfall. Fare box replacements, that is $3 million. We come up with a financial plan to cover that cost. Fixed route buses, as I mentioned earlier, we submitted a request for congressional directed spending. And a portion of that, of course, will be a local match. We will have to fund that. FY 26 capital funding needs, anticipating a minimum of $1.5 million. As additional information comes in, this number may go up. And of course, we have 2 huge projects in the front of us that will begin construction, hopefully in FY 26, the ferry maintenance facilities and the paratransit maintenance facility. And that concludes my portion of the presentation. I want to again encourage the board to think about the SPLOST 8 asks, because the board will be needed to advocate for whatever the asks are. And any items that you feel that are critical to FY 26, if they have not been included in the presentation, that you share that information for inclusion so that we can have it back to you for the next budget workshop that will be scheduled in May.
Ms. Cutter, can I ask a question about, when we have a project that was budgeted in 2025, that have, like, for instance, the renovation at the CAT Central, that was budgeted for 2025. Where do we see that money? Do we see it, is it carried forward money, or is it a?
That's grant money predominantly.
So we'll see it, so we'll still see it as an active grant?
Yes, until the money is drawn down.
Okay, so, but that will be reported to us separately, as this grant is for this, and this is the money.
Yes.
Okay, because I think we've got several projects
Yes.
that was budgeted for 2025.
Yes, it'll be show up in the 5-year capital plan, I believe the monies, well, the RFP, the proposals for the Western Dock is coming forward. That'll be coming before you. Contract awards for the maintenance facility, all of that's going to be coming forward. And the capital plan will show it. Any cost that impacts the next 5 years. And hopefully we'll have some better projections by the time we come before you. The latter part of it.
So the renovation on Overthorpe, the board approved what? We approved the RFP to move forward for the design.
The contract award for the renovation, we have contractors already in place. I think it's Pond that's working on Cat Central. They'll be starting work tomorrow.
So we've already approved.
Yes,
Okay.
yes, you have. So we're moving. Our security upgrades are in the process of being installed, access to the building. We are going to be getting information on the enclosures for the buses to better protect our operators and the public as well. Information on that will be coming forward. We're kind of looking at what other transit agencies are doing. Have to get a price on all of this. And that's a priority for 46 as well.
And what about Greyhound? Tell me about Greyhound.
Greyhound is working. Their project is underway.
Okay.
They are working.
And you guys are satisfied with what they're doing?
Yes, I mean.
This is the second time I've heard you say something about access to the building. Are you changing something with the access to the building?
Yes, it's an upgrade. We use our badge, just as we did before, but this is supposed to be, an upgrade, to our previous system.
Why do we need an upgrade?
Because of all of the safety concerns, expressed not only by staff, but the people just walking in.
But how do they get in without badge?
Well, some doors are left ajar. There were many problems with safety in this building. Some of us work late at night, and it's safety is unsafe. So we are trying to strengthen our safety in this building on our vehicles. Public safety is critical now. There's so much happening in the world, and that's what we're trying to do.
I'd like to have more explanation on that. I'd like to know how it works.
Okay, I'll pull the old action items that came before the board and just have safety come in and do a refresher for you. If there are no other questions, this concludes the first budget workshop. I look forward to receiving your feedback so that we can make adjustments and bring back those adjustments before you at the second budget workshop at the latter part of the month.
I just want to, I think to make it easy, I think the pictures are really nice, they're lovely. But if that delays you finishing up the final budget, we don't.
Oh, it's a different story.
Yeah,
This
don't
Carter
know.
don't have that time.
Yeah, I mean, they're cute, but I mean, we want to see hard things, So, yeah, so don't you guys.
Well, the budget included numbers and, I like to show the work that staff is doing
this person won't have the time that and she can't work 15 hours, 7 days a week.
Exactly.
So.
Thank you, Ms. Cutter, and as well as all of our presenters today. I'd like to thank, our staff, our community involvement, our stakeholders, and last but not least, our board members. I think anybody want to introduce themselves? We have some visitors in the house. All right, at this time, yes.
Thank you so much, staff, and Ms. Cutter for color coding this. I appreciate it. It just reflects something that we learned from the board, loving this workshop. Appreciate that. Color coding, thank you.
Next, fiscal year 2026 budget workshop will be on May 13th, 2025. Next regular meeting of the Board of Directors, May 27th, 2025. This time, I'd like this.
Mr. Chairman, may I ask for an adjustment to the May dates? That's right around the corner. I'll be getting with Mr. Dumas to propose another date for you all.
What, the workshop?
Yes, so that we can incorporate any information that you all submit to us. We can get in addition to the follow-up information that you've requested.
All right. Thank you for that, Ms. Costa. At this time, I'd like to adjourn this meeting. Thank you.
Well, it's kind of the existing thought that we have done. We turn those back in. There's one that we have.
I think they still work.
Okay, yeah, okay.
They're just gonna stop. They're just gonna stop, I guess, whenever they go live.
No, it's already live.
Yeah, it's already live.
The new system is on?
This will be